hospital, our SL Raheja Hospital, has been here for the last 20 plus years. Basically a center which was established for treatment of diabetes and management of diabetic population. So we are now planning to make this into a multi-super speciality hospital and a healthcare destination in Bombay. Fortis coming in to partner with Raheja to run this hospital seemed like a very logical step because as you're aware, Fortis is one of the fastest growing healthcare companies in Asia. And it's one of the largest healthcare providers in the country today with a network of 40 hospitals and really taking healthcare delivery in this country to a very, very different level to make it affordable for, to bring excellent clinical care to large parts of the country and abroad. Now we have centers even outside the country and we want to be a leading global healthcare player, and that's our vision, and that's why this entire partnership with Raheja and Fortis happened in the first place. When the patient comes to the hospital, I want them to get that sense of comfort that they are coming to a place which drives clinical excellence, serves excellent patient quality, and is based on good governance of transparent and ethical medical care. While we took over the operations of Raheja Hospital, we had a lot of challenges. And there was a lot of change that is going to be brought about. There was transformation in the work culture. And we decided that we are going to ride this change and use IT to ride this change. IT applications go a long way because they automate a lot of things where manual interventions are not required. And to add personal warmth and personal care, I need to free up my staff from a lot of non-medical manual work which they do right now, which the IT platform can easily handle. So I would have my nurses free to spend more time on the bedside and personalized care of the patients. When we decided to partner with Sorian MedSuite in this endeavor, we look at Siemens as a leading innovative company, well known in medical technology. And when we examined Sorian MedSuite, we found that it has the capability to integrate with all the existing IT applications that we use in the hospital, be it medical equipments, be it the back-end applications, and additionally, the capacity to enhance to fulfill our future needs in medical practice. And that was one of the reasons why we went with Sorian MedSuite. Additionally, whenever we want to roll out something of this magnitude, we are talking of HIS that can deliver clinical excellence at one end. And we are in a hospital where the basic operations were all being done manually or in a very limited, with a limited application of IT. So to bring about, we had to do it in a very stepwise, thought about phased application. So we decided to do the easy things first. So the low-hanging fruits are the back-end applications, do the financial data, do the administrative data, which we have done in phase 1.
Also, SL Raheja had an existing HIS system. So we planned the phase 1 scope to ensure a smooth transition from the existing HIS to the new Sorian MedSuite. Specifically within phase 1, we focused on RADT. This is registration, admission, discharge and transfer. We covered billing, including the insurance billing. We also had order entry and communication and clinical management, very basic functionalities of nursing, service center, and also the laboratory systems. Phase 1 covered the integration with the back office ERP and also integration with laboratory instruments.
With the implementation of phase 1, what we have achieved is revenue cycle optimizations and elimination of revenue leakages in the system. The entire exercise of successful completion of phase 1 would not have been possible had we not worked as a very, very close, seamlessly integrated team. The Siemens team has been living here 24/7 for the last 6 to 8 months. And our team from Raheja Hospital, they work in very, very close coordination. All of them have taken equal responsibility and role in product development, in modifications, in training every stakeholder in this hospital and implementation of the program. Right in the beginning, when we started the implementation exercise, we decided that we must clearly see what are the benefits that we are going to be deriving. So in order to see that we effectively monitor them, we have developed matrices for the pre-deployment phase as to how the hospital operations were running, and we are comparing them with the post-deployment phase, which will continue, and we will be developing newer indicators and benchmarks to see how we monitor. And we are slowly moving into the area in the phase 2 to do clinical templates, to do patient safety, do clinical quality, put in clinical audit tools, and to slowly move towards the clinical excellence aim that we finally want this platform to serve.
The focus that Saurian MedSuite has on clinical management aligned very well to the vision that SL Raheja has for clinical excellence and clinical governance. Some of the unique features that Saurian MedSuite has comes from its innovative technology platform, from its role-based healthcare application, integrated electronic patient record, and also because of the inbuilt scalable integration engine. The technology platform is unique. This specialty in the technology platform comes from the rich internet application, workflow-enabled business process management, service-oriented architecture, and also from the inbuilt integration engine.
When we set out on this partnership and to implement Saurian MedSuite, we felt that we cannot just be a vendor and a client. It was necessary to build a product that is very, very meaningful in the field of healthcare. To drive clinical excellence is not easy, and to have a product developed in IT to drive clinical excellence is even more difficult. So unless we share knowledge with each other and we become knowledge partners, it was felt that it would not be possible. Therefore, a very conscious decision was made from the Siemens team and from us that we are going to work together as partners. And this has worked wonderfully, and we are now figuring out that there is so much possible if we work with this relationship.